Most people develop their morning oral hygiene routine early in life and rarely revisit it. Some brush immediately upon waking, while others eat breakfast first and brush afterward. Both approaches feel natural to the people who practice them, and both are extremely common. But dental experts and the American Dental Association have a clear position on this question, one grounded in the chemistry of what happens inside the mouth during and after eating. Understanding that chemistry changes how the timing question looks, and it may lead you to reconsider a habit you have maintained for years. What happens in your mouth overnight during sleep? Saliva production decreases significantly. Saliva is the mouth's primary defense mechanism. It washes away food particles, neutralizes acids produced by bacteria, delivers minerals that remineralize enamel, and contains antimicrobial compounds that suppress bacterial growth. When saliva flow drops overnight, bacteria that naturally inhabit the mouth multiply more freely and accumulate on tooth surfaces as a thin biofilm. By the time you wake up, bacterial load is at its daily peak. This is why morning breath exists and why dentists consistently emphasize brushing first thing in the morning as one of the two most important daily brushing sessions. Brushing before breakfast removes that accumulated bacteria and simultaneously deposits a layer of fluoride onto the enamel surface from your toothpaste. The American Dental Association explains that this fluoride layer helps protect enamel when it subsequently comes into contact with food, particularly acidic or sugary foods. The protective fluoride coating is applied to a relatively clean surface, giving it the best opportunity to adhere and remain effective through the meal. The pH mechanism. Why brushing after eating carries risk. The case against brushing immediately after eating is rooted in oral pH chemistry, and Dr. Kevin Feist, general and cosmetic dentist and co-owner of Fulbright Cosmetic and Reconstructive Dentistry, explains it with considerable precision. The average resting pH of saliva falls between 6.2 and 7.6, which is close to neutral. When you eat, bacteria in the mouth begin metabolizing carbohydrates and producing acids, specifically lactic acid, butyric acid, and aspartic acid. Within minutes of eating, salivary pH drops sharply. The critical threshold is pH 5.5. Below that level, the mineral hydroxyapatite that forms the crystalline structure of tooth enamel begins to dissolve in a process called demineralization. Every time you eat carbohydrate-containing food, pH drops below 5.5, and enamel enters a demineralization window, where it is softer and more vulnerable than at neutral pH. Saliva eventually buffers itself, neutralizing the acids through its bicarbonate content and restoring pH above 5.5. But this buffering process takes approximately 30 minutes on average from the time eating stops. If you brush within that 30-minute window, you are physically abrading enamel that has been chemically softened. The physical force of the toothbrush against softened mineral surfaces removes more enamel than would be lost during brushing on a neutral, hardened surface. Over years and decades of this practice, the cumulative effect can contribute to measurable enamel loss, increased sensitivity, and greater susceptibility to cavities. The acidic breakfast problem. The timing concern becomes more acute depending on what you eat and drink for breakfast. Coffee is mildly acidic with a pH typically between 4.5 and 5.5. Orange juice, grapefruit juice, and most other fruit juices have pH values in the range of 3 to 4. Citrus fruits themselves sit at similar levels. When your breakfast combines acidic beverages with carbohydrate-containing foods, the result is a 1-2 effect on salivary pH. The acid from the food or drink drops pH immediately, and then bacterial metabolism of the carbohydrates adds further acid production on top of that, pushing pH further below 5.5 and keeping it there longer than a non-acidic meal would. Feist notes that in these situations, the saliva may need longer than the standard 30-minute window to recover. The Mayo Clinic echoes this, recommending a waiting period of at least 60 minutes after consuming acidic foods or drinks before brushing. For people whose morning routine includes coffee, juice, or fruit, this means that brushing immediately after breakfast poses a higher enamel risk than for those who eat non-acidic breakfasts, and the safe window extends well beyond the half-hour mark. Who faces the highest risk? While the timing principle applies broadly, certain people face disproportionately higher risk from post-meal brushing. FAST identifies 3 groups with elevated concern. People with xerostomia, or chronic dry mouth, have reduced salivary flow at baseline, which means less buffering capacity and a resting pH that is already lower than average. When they eat, their salivary pH drops faster and more sharply, and the recovery takes longer. People with gastroesophageal reflux disease experience periodic episodes where stomach acid, which has a pH around 1.5 to 2, contacts the tooth surfaces directly. This acid exposure leaves enamel in a prolonged state of softening beyond what normal meal acid alone causes, making post-reflux brushing particularly damaging. People who breathe primarily through their mouths rather than their noses also experience drier oral conditions because mouth breathing bypasses the nose's humidification function and evaporates saliva from the oral cavity more quickly. For all 3 groups, the recommendation to brush before breakfast rather than after is stronger than for people without these conditions. And the waiting period, if they do choose to brush after eating, should be extended towards 60 minutes or more. Technique and consistency matter more than timing. Despite the clear case for brushing before breakfast, FAST emphasizes an important proportionality point. For most people, the quality and consistency of brushing matters substantially more than its precise timing. The damage from imperfect timing, while real, is modest compared to the damage from not brushing reliably twice daily. Irregular brushing allows bacterial populations to grow denser and more difficult to disrupt, accelerating both cavity development and the progression of gum disease. A person who reliably brushes after breakfast every morning is protecting their teeth far more effectively than someone who brushes before breakfast only occasionally. The ideal morning oral hygiene practice integrates these findings into a coherent routine. Brush before breakfast, which removes overnight bacterial accumulation and pre-coats enamel with fluoride, then eat. If circumstances require brushing after eating, wait at least 30 to 60 minutes depending on what was consumed. Brush gently and follow with flossing. Floss once daily regardless of when brushing occurs. Drink fluoridated tap water. Replace your toothbrush every 3 to 4 months. See a dentist regularly for cleanings and checkups. These fundamentals collectively protect oral health far more than any single adjustment to routine timing, but the science does point clearly to the before breakfast approach as the marginally superior default for people who